Does parathyroidectomy help the quality of your life? I'm Dr. Babak Larian from Center for Advanced Parathyroid Surgery. That is a very important question because it's the main reason to do surgery, is to see if that actually does improve the quality of your life, right? So first, let's talk about all the symptoms that one can get when you have hyperparathyroidism. The most common symptom being fatigue. Now, this is a disease of people in their middle ages. More women are affected than men, but both equally affected once they have the disease. They have the same symptoms. So both women and men get fatigue, most common complaint at 96%, right? Followed by bone pain, muscle aches and pain, concentration issues, memory problems, irritability, sleep issues, nighttime urination. Some get depression, frequent urination, headaches, anxiety, upset stomach, constipation, abdominal pain, incontinence, and then some people get also anxiety and nausea and vomiting, right? But a lot of these symptoms are symptoms of just getting older, right? I'm in my mid-50s and I have a lot of these symptoms, right? And I've checked, I don't have hyperparathyroidism, but so these symptoms happen to us, right? But when you have hyperparathyroidism, they happen faster. So the most common feeling, most common sentiment when you actually sit down and talk to a person about this is, I feel like all of a sudden I just got old. I just got old. I had all this motivation. I could do all these things and I just don't feel like doing any of them. I've lost my libido. I've lost my interest in the activities I used to have. I used to be an athlete and now I just can't even get out of bed. I don't even feel like putting on my running shoes. The thought of it is just, I can't even do it. All these things, all of a sudden, I just got old. And these symptoms are very non-specific. They can happen with a lot of illnesses, right? But obviously, they also happen with hyperparathyroidism. And so the sense of getting old, but does parathyroidectomy help that, right? So let's go through a case and just kind of demonstrate what that is. And with most of my patients, with all my patients, I actually try to get quality of life service before surgery and at intervals afterwards. And I demonstrate a case that had that, and we can go through it so you can see. So this is a 57-year-old athletic woman who has fatigue, memory loss, poor sleep, anxiety, acid issues, constipation, high blood pressure, heart palpitations, and frequent urination. Her calcium is at 10.5, slight elevation. PTH is 103, a significant elevation in PTH. And vitamin D is actually normal. She had an ultrasound which looked like she had a right inferior parathyroid. So on ultrasound, you can see this is the thyroid gland, head that way, feet this way. So it's in this orientation. And the parathyroid looks like it's in the bottom part of the thyroid, right? And I took her to the operating room. She had surgery under local anesthesia with some sedation in March of 2020. And the parathyroid that was positioned in the lower part was actually, interestingly, an upper parathyroid that had migrated too far down, right? So in the hands of an inexperienced surgeon, they could have been misled into thinking that the normal inferior parathyroid was the one that's abnormal rather than this one. In any case, we took the parathyroid out. Her pre-operative, pre-excision PTH before we took out the parathyroid in the operating room was 134. At 5, 10, and 15 minutes post removal of the parathyroid, the PTH came down to 51, 43, and 38 respectively. So by 15 minutes, the PTH had gone from 134 to 38. And the range of normal is 15 to 65. So well within the range of normal and on the lower side. Good. Right? And following her recovery, at 1 month, her calcium was 9.5 from 10.5. PTH was in the hundreds pre-op and now 19. Vitamin D was a little low, so we supplemented more. At 1 year, calcium was 9.7, PTH 27, and vitamin D normalized. Right? So everything took some time, but normalized. The balancing process takes time, and symptom improvement takes time. Right? There are symptoms. There are things that happen to the body that we know for sure get better. Bone loss, right? Every person who has hyperparathyroidism and has some degree of bone loss or no bone loss at all, when they do parathyroidectomy and they check their bone density a year and a half later, their bone density will show their bones to be stronger. That happens in 100% of people who have successful parathyroid surgery, right? So bone density gets better. Kidney stones, takes about 10 years for the kidney stone risk to go back to normal. So there's some residual calcium deposits in the kidney that take time to improve. Kidney function, some patients have improvement, and some people stop the progression of their kidney malfunction. So that's an important fact. You know, if your kidney function is diminishing and you can stop it in its track, that's quite an improvement. That's quite a success, right? But in terms of all the other symptoms we were talking about, what gets better? So let's look at this person. And this is just a video of their surgery. It's kind of an animated version of it. You'll see they're separating the parathyroid from the surrounding tissue and closing the blood vessel that feed that parathyroid. That's with an electrocautery. It's called bipolar cautery, right? And then once that's done, we cut that blood vessel that was cauterized, and then we're gonna go ahead and take out the parathyroid. It's a pretty sizable parathyroid that came out. In any case, so this is the quality of life survey, right? And on this survey, you can see fatigue, bone pain, joint pain, muscle weakness, poor concentration, memory loss, anxiety, irritability, depression, sleep problems, thirst, frequent or excessive urination, nighttime urination, incontinence, kidney stone pain or past kidney stones, anorexia, loss of appetite, right? Nausea, vomiting, upset stomach, heartburn, indigestion, constipation, palpitations, high blood pressure, and hair loss, right? And this particular person marked on the survey that number 4 is never, right? And 0 is always, right? So she had fatigue from time to time, joint pain from time to time, irritability most of the times, sleep, thirst, frequent urination, excessive urination, nighttime urination frequently, constipation always, palpitations and high blood pressure frequently, hair loss sometimes, right? This is right before surgery. At 6 weeks after surgery, you see a dramatic improvement. These measures that were in the 0 to 1 range have now all improved. Palpitation is the only one that really didn't change much, but everything else improved. And this is at 2 years. You see that improvement maintained, right? So the quality of life surveys really show that a lot of these measures that are affecting you can improve in time, right? Some improve at 6 weeks and maintain, and some continue to improve over time. And so a lot of the symptoms balance out. Now, I tell the patients that the time it takes for symptoms to improve has to do with how much time you've been in the setting of hyperparathyroidism, right? How long have you been affected by this disease? And how far away is your calcium in hyperparathyroid state to the calcium level that you normally exist in, right? So the larger the difference and the longer time you're in it, the longer it's going to take for you to recover and correct all these issues, right? And the shorter the difference, right? The narrower the difference between what your calcium is and the calcium in the hyperparathyroid state, and the shorter period of time you're in that state, the less your body has adapted to these new environments, and the quicker it can get back to its original state of being. A lot of things can improve. That sense of feeling old and tired and not motivated to do things can improve given enough time, given enough motivation in you to be active and force the issue, do memory exercises, crossword puzzles so you can exercise your brain, and all these things to help improve your body and adapt to your new normal. Hopefully this is helpful. If you're interested in easy to understand parathyroid information and help with what to do next with this really awful disease, visit us at parathyroid.net.